Hello everyone, welcome back to our next recall session. So today we're going to discuss with you about anatomy recall questions of NEET-PG 2024. So let us start with the questions. The first question is an absent gag reflex can result from injury to which of the following nerves? So they are asking about absent gag reflex. Gag reflex has two pathways, afferent and afferent. Afferent pathway is mediated by glossopharyngeal nerve, which is the ninth cranial nerve, and afferent pathway is mediated by ninth and tenth cranial nerve. Okay. So absent gag reflex can result from injury to both ninth and tenth cranial nerve. So the answer here is A. The next question is if a tumor compresses the structure passing through the opening marked in the given image, which of the following sensations would be affected? So the marked structure here in the given skull image is superior orbital fissure, and the nerve passes through that superior orbital fissure is nasociliary nerve, and frontal nerve. So the sensation in the anterior scalp and dorsum of the nerves is gone due to injury to the nasociliary nerve and frontal nerve. So the answer here is the affection of the sensation in the anterior scalp and dorsum of the nose. Sensation of the nasopharynx, mucosa of the nasal cavity, and sensation of the chin. These are intact. These are absolutely fine. But the sensations in the anterior scalp and dorsum of the nose, this is gone. So this sensation would be affected. So let us move on to the next question. A chronic tobacco consumer went to the dental clinic with bleeding lesions on his tongue and was diagnosed with carcinoma of the tongue. Which of the following papillae, which do not have taste buds, is least likely to be involved in such a cancer? So they are asking about the papillae which does not have taste buds. So papillae does not have taste buds are only one, that is filiform papillae of the tongue. So these are the papillae that are least likely to be involved in such a cancer, or you can say that carcinoma of the tongue. So the answer here is B, filiform papillae. The next question is which artery is used for arteriovenous shunting with the great saphenous vein for hemodialysis and is located behind the medial malleolus and 2.5 centimeter in front of the tendocalcaneus? So this question is showing the location of the artery located behind the medial malleolus and 2.5 centimeter in front of the tendocalcaneus, and that artery is used for arteriovenous shunting with the great saphenous vein. Okay. So the artery that is located behind medial malleolus and 2.5 centimeter in front of the tendocalcaneus is posterior tibial artery. So the answer here is B. and that is used for arteriovenous shunting with the great saphenous vein for hemodialysis. The next question is, what is the outer covering of the condition shown in the image? So the condition shown in the image is omphalocele, and which is covered by amnion. Okay, so the answer here is B, amnion. The next question is, identify the marked structure. So the marked structure is here marked with question number. This one is thoracoacromial artery, this one is lateral cord of brachial plexus, this one is medial cord of brachial plexus, this one is axillary artery. And the structure marked here is with question mark. So we have to identify this structure. So the question marked structure is actually a nerve which arises from the medial cord of brachial plexus, and that is nothing but the medial pectoral nerve. So the answer here is B, medial pectoral nerve. The next question is, a patient presents with sciatica and tenderness in the hamstring muscles. Which nerve supplies the hybrid muscle that is likely to be spared in this condition? So the hybrid muscle they are talking about in this question is actually adductor magnus. And adductor magnus is two part, adductor part and hamstring part. Adductor part is supplied by obturator nerve and hamstring part is supplied by tibial nerve. So tibial nerve is actually involved because hamstring part of adductor magnus is supplied by tibial nerve, and that is also involved because sciatica is caused by the defect at the sciatic nerve. And sciatic nerve divides into tibial and common peroneal nerve. So the hybrid muscle that is supplied is adductor magnus they are talking about, and adductor magnus is two part, adductor part and hamstring part, and adductor part is supplied by obturator nerve and hamstring part is supplied by tibial nerve. So the answer here is D, obturator nerve, because femoral nerve is not supplying any part of this hybrid muscle. So this is not the answer. Tibial nerve is supplying actually the adductor magnus, but that is involved in this sciatica. So this is not the answer. And common peroneal nerve is not supplying the adductor magnus muscle. So this is also not the answer. So the answer here is obturator nerve, which is supplying the hybrid muscle, and that part of hybrid muscle, that is adductor part of the adductor magnus, that is likely to be spared, and that is supplied by obturator nerve. So then let us move on to the next question. Where will you find the epithelium shown in the image? So this epithelium is actually showing the transitional cells. So it is actually the transitional epithelium. And transitional epithelium is actually seen in C, ureter. So the answer here is C, ureter. The next question is, during the examination of a patient, a professor asks the patient to invert his foot and points to a prominent tendon located behind the medial malleolus. Which tendon is being highlighted? A simple as well as straightforward question. The prominent tendon which is located behind the medial malleolus is nothing but the tibialis posterior. And the professor is highlighting this tendon in this question. So the answer here is C, tibialis posterior. Okay. The next question is an elderly woman reports difficulty in buttoning her shirt and increased clumsiness during daily activities. On examination, she is unable to make O shape by opposing her thumb and index finger. Which of the following muscles is most likely involved? So she is unable to make O shape by opposing her thumb and index finger, as well as reporting the difficulty in buttoning shirt and increased clumsiness in daily activities. So this is actually the symptoms that are described in the question. So let us look at the options. Opponens pollicis, palmar introsi, flexor pollicis brevis, and abductor pollicis brevis. So this clinical scenario is actually suggestive of anterior intraosseous nerve syndrome because anterior intraosseous nerve is supplying the abductor pollicis brevis muscle, and and that abductor pollicis brevis is supplied by anterior intraosseous nerve that is likely to be involved in this scenario. So the anterior intraosseous nerve syndrome, what are the symptoms? The patient repeatedly reports the difficulty in buttoning her shirt, increased clumsiness in daily activities, unable to make O shape by opposing her thumb as well as index finger, and difficulty in fine motor skills like making an OK sign by opposing thumb and index finger. So these are mostly the symptoms of defect at the supply by anterior intraosseous nerve, that is known as anterior intraosseous nerve syndrome, and the muscle supplied by anterior intraosseous nerve is abductor pollicis brevis. So the muscle likely to be involved in this is D, abductor pollicis brevis. Okay, so with this we complete our session. So thank you so much for watching, and see you in the next one.